And then I got the news, it was December 20th of 2011, that I had cancer in my colon. And after they had looked into it further and did a biopsy, it was ovarian cancer.
But it still hadn't really hit me. And I said, well, what if I hadn't come in to see you today? And he said, you probably had about 5 weeks left to live.
We eventually made it to the emergency room, and they did some tests, and it was only after surgery we found out that I had cancer.
She said, well, let's get in for another mammogram. I was diagnosed with invasive lobular carcinoma, which apparently mimics breast tissue.
My doctor kind of jumped on me right quick and said, we're talking life and death here. And I'm lit up. I said, you got my attention. What are you talking about? He said, I'm talking about the possibility of having cancer, Dan.
You know, you get that diagnosis with cancer, and you just think that's the end.
It's hard to explain the shock that you feel and the kind of devastation.
Anytime you hear the word cancer, it's pretty terrifying because you don't know what that means for the long term, and everybody's cancer is different.
It's the change it creates, I believe, in everybody's life, because it touches everybody around you, everybody you know.
I asked him, am I going to die, and am I going to lose my hair?
It's scary, but it doesn't have to be terrifying.
I was a little freaked out but I was going to fight it, so it didn't matter. And I'm not ready to go yet.
If you have to be diagnosed with cancer, the best place in the world to be is Springfield Clinic's oncology department. They always take time to talk to you, to explain things to you.
You know, it's huge to have a doctor that's not just your doctor, but is your caregiver.
I mean, the doctors, the nurses, they're all very cheerful and caring.
Springfield Clinic is just, it's a super place, like I say, with people that are genuine.
I just felt like I was in great hands.
Today, I feel fine.
I would never have dreamed that I would be able to do the things that I'm doing today.
I might have a sad moment or a worrisome moment, but I don't have, bad days or worrisome days.
I want to be an example for my girls. I want them to learn how to be a woman and how to live life through me.
I want to prove it wrong. I want to prove cancer wrong.
I'm going to beat this thing, and I'm going to do everything it takes.
Get good doctors and get a good support system. I'm lucky that I've had all of that and more, It's gotten me right here today.